We all carry around one of these, one of the most basic pieces of veterinary equipment. But do you know how to use yours properly when you're listening to a horse's heart? Are you getting the most out of your stethoscope? Or maybe you need a new stethoscope, maybe an electronic one like mine if you too have reached that age. I'd like to invite you to the Beaver Practical Equine Cardiology course, which is being held at the British Racing School near Newmarket on the 20th of May 2015, where you will learn how to get the most out of your stethoscope. It is the 16th consecutive year that it is run, which is indicative of the quality of and also the demand for this course. As the title suggests, the course has a significant practical component. Both the morning and afternoon sessions start with formal lectures, followed by practical sessions where you have the opportunity to evaluate many clinical cases. The formal lectures will be delivered with the characteristic sardonic northern humour of Leslie Young and Karen Blissett, the Ant and Dec of equine cardiology, or would that be Dick and Dom, or even Laurel and Hardy. During the practical session of small groups of 3 or 4 delegates, rotating around clinical cases, Leslie and Karen will be ably assisted by 5 other eminent equine cardiologists. You'll be taught and also given the opportunity to practice a straightforward, systematic approach to the location of all of the heart valves, which you'll be pleased to hear does not involve counting rib spaces. You'll be able to hone your technique and develop your clinical skills so that you can confidently identify all of the day-to-day murmurs and arrhythmia found in horses. In addition, your clinical skills and newfound knowledge will allow you to interpret your auscultatory findings and allow you to best advise your clients in the future. You will acquire a logical approach to interpreting your clinical findings. You will also learn about further relevant diagnostic tests which may be used. And you'll also learn about current treatment and management strategies for equine cardiac disease. Having attended this course, first as a delegate, more years ago than I would care to remember, and more recently as a demonstrator, I think this course is a must for all practitioners. Whether you're a recent graduate, wanting to develop skills in equine cardiology, or you're a more seasoned campaigner who wants to refresh their skills and be able to offer current advice on some of the cardiac anomalies which you will inevitably encounter during your day-to-day work, such as at pre-purchase examinations. I promise you, if I can do it, equine cardiology cannot be that difficult. On the other hand though, I was taught by the best. By the way, if you have a stethoscope like this one, you definitely do need to get a new stethoscope. If you'd like to attend this course, then please contact Debbie at the Beaver office, or alternatively visit the Beaver website at www.beaver.org.uk. We look forward to seeing you there. Thank you. We all carry one of these around, one of the most basic pieces of clinical cases. Karen and Leslie will be ably assisted by 5 other eminent cardiologists. Please stop doing that. Allow you to best advise your clients in the future. The newfound knowledge will allow you to www.beaver.bollocks. It's best in the future. Best advise your clients. Oh, shit.